Good afternoon. I'm Robin Steyerwalt, and this is my friend Amy Brundle from NAMI, North Carolina, and she's here to talk with us today at Welcoming Wellness. Welcoming Wellness is an initiative of White Plains United Methodist Church in Cary, and our purpose is to help people suffering from mental illness, to help their caregivers to find them the relief and the help that they need. We also strive to create a community of acceptance where there's no judgment, that we can encourage people to actually seek help when they need it instead of experiencing the stigma that is so often associated with mental health issues. So I wanted to have Amy come and talk to us today because we've done some presentations. We've got about a year's worth now, and we haven't really talked about excuse me, we haven't really talked about what are the symptoms and signs of a mental health issue or a mental health crisis, and what can we do about that in the moment. So Amy, you want to tell us a little bit about those type of things? And
Sure. I'll say that I have been with NAMI North Carolina for about 2.5 years. And I originally wanted to get involved with an organization like NAMI because I was diagnosed with my own mental illness in 2006. And before that point, had really not had any kind of touch point with mental illness, and certainly did not expect to be a patient at any point in my life. And as I was starting my recovery journey, recognized that there was a lot of opportunities to be stigmatized. Especially, I was starting seminary that year, and especially in faith communities and that educational setting, mental illness was largely considered kind of an issue of a lack of faith. It was not really taken seriously. It was seen as an excuse for poor performance. It was seen as, you know, um, evidence that your spiritual life was not on par. And as somebody studying to become a minister, that was a problem. So it took a while for me to become comfortable seeking treatment. And then I get with an organization like NAMI, more than a decade later, and there's an entire community of people who are actively going out into the community and saying, no, it's okay. Do what you need to do to take care of yourself and the people around you. And so now I'm very passionate about coming out in the community and reaching out to people and educating them on topics like this, because really all of us need to know that we are not alone, that recovery is possible, and that mental illness is not either a death sentence or a sign that you're going to be just confined to a life of no joy, no adventure. I'm thriving now, and I want to see other people do the same.
we are just thrilled to have you with us today. One of the things that I think is really important is to create this community of acceptance. And I see NAMI and you working very hard to do that. I've known Amy for a while now, and she's extremely good at her job. And we are just thrilled to have her with us. And we're going to get to the presentation now and let her tell you all of the things that she knows that might be helpful for you. Thank you.
So what we're going to talk about today is really about kind of starting with some of the basics and recognizing what do mental health symptoms and what does a crisis look like in people that you might know. And it also might help you recognize some of these things in yourself, things that you saw as personality flaws or just your lack of strength in a moment or something like that might actually be a symptom of something that you could receive treatment for. So kind of moving on to the next, we're going to start with the big guns, okay? So when we talk about crisis, obviously we have to talk about suicide and how it is a prevalent problem in the United States. It is the second leading cause of death among youth who are 10 to 19 years old, which I don't know about you all, but that's one of the most horrifying statistics I think I've come across in this job, and I see a lot of them. Our youth specifically are in crisis. It is the third leading cause of death among adults 19 through 34. So it's not just our kids. It's not just our older folks. It's people who should be in a position to feel like they have their entire lives ahead of them and are really just getting started, and yet they're struggling. Contrary to popular beliefs, 78% of suicides are white men. This is like one of the few areas in life where white men are distinctly disadvantaged, probably because they have not, in just a lot of societal ways, they have not really been taught how to deal with struggle, how to deal with disadvantage, and so they don't. North Carolina saw a 4% increase in suicides since 2019. The pandemic was an enormous reason behind this, the isolation that came with that, the financial uncertainty, it's all kind of added to that. Adults 45 to 64 are at the highest risk, and Native American people have the second highest risk in the country. So this is a problem that spans races, ages, demographics, socioeconomic. I mean, it doesn't discriminate. So why do I mention this except to just bring the mood immediately down? That's not the intention. The intention is to show that, as we'll go on, it is possible that somebody that you know has experienced a mental health crisis or contemplated suicide, and you may not know that at all to look at them. 1 in 5 adults, American adults, has symptoms of a mental health condition. That could mean that 20% of the people in this room live with symptoms of a mental health condition. 20% of the people in your churches, 20% of the people that you work with are every day going about their lives living with symptoms of a mental health condition. The people around them may not be aware. Some of this stuff is really obvious. Some of this stuff is not. And part of the reason behind that, I think, is because our society is still living with the stigma of coming out and saying out loud, I have a mental health condition. Like, my being able to say that at the beginning of this presentation took 20 years of living with. And I would say it to friends, and those friends suddenly, we didn't converse as much anymore. We didn't hang out as much anymore. They didn't know what to do with me anymore. I would say that in workplaces and have my capacity for doing my job or performing my ministry questioned, because now they knew something about me. Ironically, I think we tend to, if we hear that, we tend to think of those people as now possessing a weakness instead of possessing the strength to keep going about their lives, even with these symptoms. But we have been taught that mental illness is a weakness. It is a failure of personality. It is a lack of strength. And so a lot of people will suffer these symptoms and not talk about them. And so you could have people in your lives that you are aware of, but not aware of their condition. And so one of the biggest catalysts for this sort of awareness program, this sort of presentation, is to make you aware of what you could be looking for so that you are the safe space that recognizes what's going on with those people and comes to them and says, I understand that you're struggling. Let me be a source of help. So we're going to look at some signs of a mental health condition. These might seem really obvious. Feelings of sadness or hopelessness, confused thinking or reduced ability to concentrate. Many mental illness symptoms really just involve becoming so insular with your way of thinking and with your way of perceiving the world that you're not really in tune with the things happening around you. There's excessive feelings of fear, worry, or guilt. Extreme mood changes. Somebody is on top of the world the next day or one day, and then the next day unable to get out of bed. You've got withdrawal from friends or activities. The person you're used to seeing at that weekly book club meeting is no longer showing up with no explanation. This comes with a lot of physical symptoms too, like significant fatigue, low energy, trouble sleeping or sleeping too much, changes in eating and appetite, an inability to cope with stress. If everyday inconveniences are suddenly completely throwing you off the wall and you have no self-regulation skills whatsoever, that could be a sign. Trouble understanding or relating to people or situations, again, especially like depressive disorders, are very insular. They really make you turn in on yourself, and the only things you're focused on are your emotions, your feelings, your way of processing this. So you have trouble empathizing with other people because you can't get out of your own hole. Changes in sex drive, detachment from reality, hallucinations, delusions, excessive anger, hostility, or violence. And of course, the big one is thoughts of suicide. So all of these could be considered symptoms. And you do not have to possess every single one of these. I don't know a single person who's ever possessed every single one of these, no matter how ill they are. But if you've got a handful of these things kind of going on at one time, that's usually not a normal reaction to things going on in your life. It's a signal that you may be having a hard time processing these outside stimuli and could use an extra evaluation or extra treatment. If we keep going, warning signs of a mental health crisis basically are all the things that I just talked about, except exacerbated to the next level, right? This doesn't mean that you've got symptoms that could seek, an easy treatment, or you're high functioning, but you're struggling with how you process certain things. This is heightened. This is next level. We need to talk immediately about how to get this person treatment, right? So an inability to perform basic tasks. If it is a struggle to get up and brush your teeth and shower and make your breakfast the next morning, that's a problem, okay? Rapid mood swings, just really violent shifting from one side to another. Increased agitation. If your behavior or mood start really affecting the people around you to a heightened degree, right? If you start isolating from all of the activities that you are regularly a part of, and not just, I'm going to take a break for a couple of weeks because I'm not feeling myself, and so I'm just going to take some time for some self-care, and then I'm going to be back, because I just needed a little break. No, this is everybody and everything is cut off, and you haven't left your house in a week, right? It's that kind of thing. You start losing touch with other people, and you develop a loss of touch with reality. That's a big sign that something huge is going on. If you just no longer have any connection to the outside world, including paranoia, that can be a sign of something called psychosis, which is a symptom of a larger illness. It basically just means that your perception of the world has no connection to what it actually looks like. Okay. So as we boil this all down, if you see significant changes in somebody's mood, behavior, or appearance, it might be worth checking in. It could be that that person had a traumatic event happen in their life and they're just reprocessing, right? And it's just going to take a little bit of time, and then they're totally back to normal and they don't have a mental illness. It could be that they are developing symptoms of an actual mental illness and they need to be checked on. Okay? So these are kind of the three that I keep in mind. But when in doubt, ask the question. So let's say that you have noticed that a friend of yours has withdrawn from people. Their moods are all over the place. They're really angry at inappropriate times. They really just don't want to talk to anybody. They stopped going to work. They look like they haven't engaged in hygiene in a hot minute. You've got all these signs happening, right? It is very easy to want to be like, well, I don't want to pry, so I'm just going to let them do their thing. And I'm not going to say anything because I don't want to, either I don't want to be a trigger, or I don't want to be wrong and ask them about it and they're actually fine. Or I don't know if I could deal if there was a problem. Maybe somebody else should handle that. I don't feel equipped to handle that. That's very tempting, and is unfortunately what a lot of us with mental illnesses have had our friends and family do, which is why it suddenly became upon us to just totally go reach out for treatment and do things ourselves. We might not have had those advocates, those people in our lives who kind of made that final step, right? But what I usually advocate for, and what generally we advocate for in the mental health community, is just ask the question. Just be the person who can go up to your friend and say, okay, I've noticed these things. I'm not judging you, but I want to know, is there something going on? Is there something causing some of these changes that I've noticed in you? You didn't used to act this way. Now you do. What's going on, right? Just ask them about it. They could say no. They could say everything's fine. They could lie to your face. But you have just proven yourself as a safe place to talk about this potentially. And you also showed them that the changes that they're undergoing, which if it's showing on the outside, it's twice as bad on the inside, right? So the changes that you're noticing, that they noticed, they saw the changes in you and genuinely want to help. Now you're that person in their life, right? And so when they are ready to kind of be like, okay, yeah, something's going on here, and I do want out of the hole, that's the person who reached out to me. That's the person who said something, who noticed, and who might be able to be my confidant in this moment. You've established that, right? So you listen without judgment. You express concern. You reassure them that there is hope. You're not just coming to them to ask because you want to judge them or because you're feeling gossipy and you want, tea for the next, church meeting or book club or whatever it is. You're not doing any of that. You are genuinely reaching out in concern and saying, I have noticed these changes and I want to find out if there's anything behind them so that I can help you get help, because I know that getting help for somebody with mental illness is very difficult to do completely alone in a vacuum, right? It's just hard. It's hard to make that step. But if you have somebody beside you that you know sees you, thoroughly sees you, it makes it so much easier. And then be willing to do that, right? Once you've seen them, once you've talked to them, you help them take the next step toward finding treatment and support. And so what you can do when somebody's in active crisis, which again is kind of like seeing those mental health symptoms in somebody, but they're all exacerbated, they're at the next level. You want to do 4 things. You want to stay calm, first of all. If you come to them and you are in a frenzy because you are worried about them, you know what that does to somebody in an actively anxious state of mind where they're risking self-harm? It makes it 10 times worse. You've got to be that steady anchor that brings the temperature of the situation way down so you can actually come up with a game plan. Okay? Listen non-judgmentally. You may have whatever opinion you want about how this person has handled their mental illness. You may be working through what you believe about mental illnesses in general. None of that is relevant to that situation right there. What is relevant is getting that person the help they need in that moment. If they are not in immediate danger, like if they're not actively trying to harm themselves or harm other people, you can contact a mental health provider for assistance. So say, I'm in I can just give you an example. I've had nights where the anxiety was absolutely turned up to 11 and I am really unable to get out of my own head, And so my husband and I have people we can call, kind of a game plan of we're going to go through this step, this step, this step when it gets to that point. And so that, you've got kind of providers that you can contact in that moment. Maybe that person has a therapist or a psychiatrist. You can get a hold of their number and be like, hey, this person's in crisis. I don't want you to break confidentiality, but what do you suggest I do in this moment so that I can help? You can also call 988. 988 is the National Suicide and Crisis hotline number. And there are people staffing that number 24/7 that can help you get supplies, resources, that can help direct you. They have a database of crisis centers in the area. And so they can automatically just go ahead and send you that information, and then you can help that person. There's also mobile crisis teams that they're connected with. And so those people can actually drive out to your location and go ahead and provide some intervention support right then and there. If they are in immediate danger, if you are noticing that this person is one push away, right? You want to call 911 and you want to ask for a CIT trained officer. CIT stands for Crisis Intervention Training. It's something we actually do a lot with at NAMI North Carolina. It means that officers have gone through de-escalation training so that they don't immediately treat a mental health crisis like a crime in progress, which is how we get a lot of our mentally ill people in jail. There's a lot of work being done right now to make pathways so that that doesn't happen nearly as often, and people can have mental health support connected to law enforcement so that those de-escalation techniques, those let's take you to a hospital instead of a jail situations happen a lot more frequently. Okay, so you ask for an officer that's trained in CIT, they automatically know how to get that process started so that it doesn't end even more poorly for that person. Okay, thank you. So here are some helpful resources, and I'll go through a bit of this. You've got your warm lines and you've got your hot lines. These are different normally. So both of them have very important purposes. Warm lines are going to provide mental health resources and guidance for people struggling with mental health conditions and family members who are looking for added support. So like NAMI North Carolina, we have a helpline that's considered a warm line. People can call us and we will give them, like, we have a database full of information of local providers, inpatient centers, mobile crisis teams, etc. And so a lot of times what we'll get is family members calling us and say, you know, I have a loved one who is struggling with XYZ. Could you show me the next step in the process to get them some added help, or help finding employment, or help finding housing, or help finding, you know, where they can look to get a better insurance policy to cover all of this treatment? And we can help with all of that. We can also be a compassionate ear. Sometimes people will call and they're just like, I need somebody unbiased and unrelated to me to talk to you for 20 minutes because all of this is hard. Sure, call us, absolutely. The other warm lines are similar, especially the NC Peer warm line is staffed by peer support specialists, which are people who have lived experience with mental illness that have undergone training to turn around and help other people with lived experience. And then you have your hotlines. Hotlines are going to be specifically staffed for people trained in crisis intervention techniques. So those are going to be your, I'm in immediate danger and I need to talk to somebody right now. That's going to be those situations. So you've got your 988, you've got your veterans crisis line where it's basically 988 plus an extension. And you can talk to people who are especially trained to handle crises among veterans. You've got Hope Line, you've got your National Domestic Violence Hotline. These are going to be especially for people in crisis. And a lot of these lines work together. So if somebody calls us and they're in crisis, we patch them over to 988 immediately. If somebody calls 988 and they're not quite in crisis, but they really could use help developing a plan for next steps, usually if they're in North Carolina, they'll send them right to us because we can help with that faster and not tie up a line for somebody who's in crisis. So these things work together and they're similar, but these numbers are really helpful for anybody to have on hand because you just really never know who you're going to encounter that might need this information. So, take a breather from that. Thankfully, like, all of this sounds really dour, right? There's a bunch of us walking around, not able to, to experience life without mental illness. We're doing our best, but all of this is hard. Yes, but there are organizations who are trying to make the lives of people with mental illness and their families easier. And NAMI North Carolina is one of those. And so there are several programs that we offer that try to provide education and support to people with mental illness and their families. I'm going to highlight a couple of them. So NAMI Family to Family was established, it's probably been 40 years that this class has existed. Family support was the original reason why NAMI came into existence. It was because there were people with adult children living with schizophrenia who, and the families were trying to be supportive, trying to provide help, but really didn't feel comfortable talking about it in public, and also felt like they were the only one around them struggling with that issue. Well, it turns out they weren't. And so they started developing support groups with each other. And those support groups turned into these evidence-based classes like Family to Family. So it's an 8-week course for family members, caregivers, loved ones of adults with mental health issues. Evidence-based programming means that we've got data proving that these programs are beneficial. It provides mutual support and shared positive impact. So not only are you sitting in a class with trained facilitators who have been through this process with their own families before, but you're also getting the benefit of your classmates, of people who have tried different things. Maybe this worked, maybe this didn't, but you're all now sharing your experiences with each other and learning from each other. So some of the things that you can learn are how mental illnesses affect the brain, different treatments and therapies. You can learn how to solve problems and communicate effectively. You can learn how to find different community resources and supports. You can learn how to handle a crisis. And you can also learn things like how to make time to take care of yourself. Because if anybody who has been a caregiver in any context knows, you cannot pour from an empty cup. So the class also teaches you how to practice your own self-care so that you have the energy and the mental fortitude to give to somebody else who needs you. So similarly, we have a course called Peer-to-Peer. And basically, this is the same kind of thing, but it is a class taught from people with lived experience to people with lived experience. So if you've just received a diagnosis or you just begun your recovery journey and you want to learn more about kind of what it's like to live with a mental illness but still thrive and, make your own good choices and all of those things, you can take this class. It's an 8-week course for adults with mental health conditions, taught by trained peer leaders. And again, it provides that mutual support and sharing of resources. So you can learn from people who might be further along on your recovery journey than you are. You can learn how to set a vision and goals for the future. For those of us who, have been kind of in the bowels of this, some looking to the future is often really difficult because all you're seeing is that day and that surplus of emotional turmoil, and you're not really thinking about tomorrow so much. So this can help you do that. You can learn how to partner with healthcare providers to find the treatment that fits you. It's really important for people with mental illness to learn how to advocate for themselves and speak up about treatments that may work for them and treatments that don't. You can learn how to share your story with others. And you can learn how to practice your own self-care and relaxation techniques and about different coping skills that you can use throughout the day to just kind of keep yourself well regulated. Now, these are not the only two programs that we offer. We actually offer a lot. For example, I've listed a few of the signature programs here. And all of our programs are led by our local affiliates. So NAMI North Carolina is the state branch of a national organization, and we kind of help administer 24 different local affiliates around the state. So this area would be covered under NAMI-Wake County. And the affiliates are the ones that go out in the communities, they teach the classes, they lead the support groups, they do a lot of the community-based work. So some of the other classes that we teach are like Homefront, is specifically for family members of veterans. Help them understand what their vet went through, how they can be a good support, how they can also take care of themselves and guard themselves against abusive behavior that may come from that veteran's mental illness. NAMI Basics is for the parents of children who are going through symptoms. It's very different. It can manifest itself very differently. And so those parents learn how they can help their children advocate for treatment. NAMI Support Group and our Connection Support Group are just that. They are support groups for Connections is for peers. NAMI Family Support is obviously for families. But it is a safe place where you can go and you can talk with people who are experiencing the same things as you without judgment. I know that right now my mom is caregiving for her mother who has a neurological condition. And sometimes the thing that she wants most is to be able to say how frustrating things are for her right now without feeling judged. And sometimes caregivers of mental illness, they need that, right? They need to just be able to walk into a room and say, this is hard, and sometimes I'm resentful, and sometimes I'm angry, and sometimes I have a hard time taking care of myself. And to be able to say that in a room where they're not going to be judged for it, and where people are like, yeah, I've been there too, this is what helped me. So that's a core reason why we hold these support groups, is because people need to know that they are not alone in their situation, that there's, 20% of us are walking around experiencing the same things, right? And then we do presentations, kind of something like this, where we offer bespoke presentations, kind of providing awareness and education to people. But we also have signature presentations like In Our Own Voice, which teaches people how to tell their own stories. That's really important, especially for eradicating stigma, because the more of us that talk about it, the more prevalent it becomes in our societal conversation, the better for all of us. But also, NAMI has a big advocacy arm where we actually go in front of legislators and policymakers and state government agents and so forth to express to them the need for better mental health care access, better treatment options, better insurance coverage, better parity across, racial and gender and socioeconomic lines. We advocate for all of that. And so having people learn how to tell their story and how they would have been better helped along if the system worked better, we encourage that, because that helps us all kind of reach a goal of making mental health care treatment easier for everybody to ascertain. You're always welcome to contact us with any questions, any information. Our website is a treasure trove of information about different mental health care illnesses, different techniques, up-to-date information. We run a webinar series where we have different experts come in and talk about various issues. Please contact us any kind of way. If you're struggling with something and you just want somebody to talk to about it, you can contact our helpline. You can contact 988. There are resources out there to make sure that you know that whatever you're experiencing, you're not alone in it and somebody cares. And hopefully, with this and other education that Welcoming Wellness is supplying, you can also be that person that's actively caring for those around you, now that you might understand it a little better.
We are so pleased to have had Amy with us, and let's give her a hand. And one thing that I heard very strongly in everything she said today was community. And I can tell you that it is so important that we can provide a safe place for people when they're experiencing symptoms or they think they're experiencing symptoms, to be able to come without stigma and without judgment. And I heard that very clear in everything you said. Thank you so much. And I did want to comment, having taken the Family to Family course, Keith, my husband, and I took that several years ago, which was before Zoom. So ours was on a Sunday afternoon. And I just have to say, I know the Zoom stuff is great, but if you want the feeling of community, go in person. That just makes a huge difference. And I did see a notification this week where the Wake County affiliate is talking about having a family-to-family class. So you might want to check into that if you're interested, because they only usually do a couple of them a year. We have wonderful facilitators, leaders in ours, and it was just a huge benefit for us. So let's talk about next month. Next month, which is going to be on April the 6th, our presentation is going to be by Waylon Eddings and Caleb Varnell. Waylon is a financial advisor, and Caleb is an attorney that's going to be assisting him. And the subject is what happens when you're gone. What if you're a caregiver, whether it's a financial caregiver or a day-to-day caregiver? What happens when you're gone? Who takes care of your loved one? So they're going to talk to us about that. So I think that's going to be great. You can visit the events page on our website to get a little more information about that. Also, our services, our presentations are free. But there is a Donate Now button on our website at welcomingwellnessnc.com. And if you found value here, we would love to have a donation and have a little something extra today. One of our committee members has made some little fans, and please feel free to take some. And they say you are not alone. And then on the other side is welcomingwellnessnc.com. So please take as many as you'd like to have. You can pass them out and give them to other people just to help promote what we're doing here and to give them an easy access to, what was that website again? So they'll have it right there in their hand. So thank you all so much. Amy, thank you. And Amy will be at the front to talk for a little bit, and she is going to forward some literature to us, which will be available at our next in-person meeting. Thank you.